We now present a short video of instruction on using the program ParEnt for the calculation of parenteral nutrition. This short tutorial is just about instruction in the use of the program, has no scientific purpose at teaching parenteral nutrition. Let us start now a brief introduction of how to use ParEnt for prescribing a pouch of parenteral nutrition. To use the program, you must enter your credentials. Once you have logged in the program, you can prescribe parenteral nutrition. You have to choose the patient in the patients list or add it as a new patient. In this case, we add a new patient. Once you have logged in, you must add the personal data of the patient for whom parenteral nutrition is prescribed. We now enter any name, for example, Andrew, date of birth, gestational age, in this case we enter 28 weeks, male gender. There is the possibility of keeping the patient within the list of hospitalized patients, or possibly obscure it. The hospital of our patient should be selected, the date on which the pouch is prescribed, weight in kilograms, length, cranial circumference. The only essential figure is the weight. Length and cranial circumference may not be entered. At this point, we select our patient from the list of hospitalized patients. Once the patient screen is open, the child growth curves, weight, length and cranial circumference are positioned on the intergrowth 21st. Clicking on the blue button, we proceed to make the prescription of the pouch. This is the page for the prescription of the nutrition pouch. It contains the personal data of the patient, name, surname, date of birth, gestational age on nutrition day, weight, length, cranial circumference. It is possible to enter a processing weight on which to calculate the pouch, if different from the actual weight of the child, for example, in the case of an important edema. At this point, it is possible to enter nutritional contributions. Here we insert the parenteral nutrition contributions. Let us start entering the total of liquids we want to administer to the patient, quantity of carbohydrates, lipid, amino acid, electrolytes, minerals, calcium, phosphorus, magnesium, vitamin preparations and water-soluble vitamins, fat-soluble trace elements, zinc or possibly carnitine. In this grey column we find the contributions recommended by the most recent SV guidelines published in 2018, whereas in the column on the right from the drop-down menu it is possible to choose the different glucose solutions, lipid, amino acids and other components now on the market for all the different substrates. Contents of the pouch are reported at the right end along with the entire list of the different thinners present in the pouch, total volume of the nutrition pouch, infusion speed, osmolality. It is possible to choose the infusion date when different from the preparation date, the infusion catheter, be it umbilical vein, CVC or peripheral vein. We click on Save and proceed to view the PDF to send for preparation. The PDF reports the data of the prescribing physician, patient data, pouch composition, amount of flow, the total of contributions per kilogram, osmolality data, infusion speed and the catheter we choose. ParEnt, moreover, allows you to calculate other contributions in separate lines, drugs and blood components. Let us see in detail now. If we wanted to unextend some inputs from the parenteral nutrition bag, it is possible to insert separate lines. Let us consider now a patient with a borderline glucose intolerance. We decide to administer the glucose in a second line to modulate it with greater precision. For example, let us see how it is possible to administer in a separate line these intakes of 8 grams per kilo per day with 24 ml of glucose 33. Clicking on Add Separate Line, we are able to add any inputs choosing from the drop-down menu, in our case glucose 33. We decide to administer part of the carbohydrates in a second line, 12 ml of glucose 33, joining the parenteral nutrition pouch by clicking Y. Our program has therefore spun off glucidic contributions from the pouch. In this case, we have just 12 ml. Our pouch is reduced in volume, osmolality, speed of infusion was reduced, calculating the contributions in second line. 12 ml glucose at a rate of 0.5 ml per hour. Our program also calculates osmolality to Y by osmolality of the pouch and of the separate line. In our PDF is therefore possible to evaluate both lines, pouch and relative separate line, with both infusion rates. As well as the separate lines contributions, it is possible to add drugs. Choose from the drop-down menu the most commonly used drugs in neonatology. In our example, we click on dopamine. Infusion amount of drug to be administered. For continuous infusion drugs, we select the ml now from the drop-down menu, our thinner, and our infusion route, if the Y with the infusion pouch, or in parallel. The program tells us if the selected drug is compatible with the parenteral nutrition pouch. The program does not control the compatibility of drugs. Moreover, we can choose whether to administer blood components. Again, from the drop-down menu, we select the substance and enter the quantity in absolute ml or ml per kilo. The program performs the count of volumes administered through the drugs, through the blood components, and deducts the water component to meet the required volume. The PDF shows our choice. Then, at the bottom of our pouch, are reported the drugs, blood components, and relative doses. Let us see in this part how our program ParEnt allows us to integrate the contributions of parenteral nutrition with the beginning of enteral nutrition. In the course of enteral nutrition, you can enter in the program the liquids prescribed by enteral nutrition. From the drop-down menu, we choose our nutrition. Many artificial formulas are present, as well as data relative to breast milk, whether from the bank, premature or term, and we enter the dose of the enteral nutrition prescribed. In this case, we start with a minimal enteral CV with a dose of 15 ml per kilo. The appearance of this string reading conciliato means that our program suggests the operator what are the contributions of parenteral nutrition to be administered according to the quantity and quality of the type of enteral nutrition prescribed. In our case, for example, of minimal enteral CV, our program counts the amount of enteral nutrition administered. Therefore, it allows the operator to see what are the individual nutrients that will be administered for enteral nutrition, but does not subtract them from the parenteral nutrition that is programmed. Therefore, the quantities of nutrients that are administered will not be deducted from the contributions administered by enteral. The blue column shows the recommended requirements in the course of enteral nutrition. In the case where enteral nutrition is greater than a minimal enteral CV, let us see what our program suggests. For example, we consider the nutritional intake of 40 ml per kilo per enteral, in this case, from the total calculation of the nutritional contributions to be administered to the patient, only the water intake is reduced, in the sense that enteral nutrition is considered as if it were water, and therefore, if we want to prescribe a total of 150 ml per kilo of total volume to the patient, 110 will be administered by parenteral. This figure considers 150 the amount we want for our patient, less the amount of enteral nutrition. Then the volume is reduced, but the amount of nutrients is not reduced. For example, if we want to administer 12 grams of carbohydrates to this patient, the amount per os that is administered, equal to 2.5, is not reduced, and the same for all the other elements, lipids, amino acids, electrolytes, and minerals. Further down the page, we can see the reckoning of both parenteral and enteral nutrition, and the totals, and the total calories administered intravenously, enteral calories with the total quantities. If the amount of enteral nutrition increases, we enter a different scenario. Suppose this patient assumes 70 ml of enteral nutrition per kilo of weight. Our program suggests what should be administered in the nutrition pouch. To this purpose, some algorithms have been inserted, which, depending on the nutritional properties of the prescribed enteral nutrition, suggest a different pouch to administer. For example, for 70 ml per kilo of premature breast milk, the pouch suggested by the program will have a total of liquids equal to 110, with 10.5 gram per kilo of carbohydrates, 3 gram per kilo of lipids, 3 gram of amino acids. Regarding the choice of electrolytes, it is theoretical and must be carried out by the individual operator and depends on the biochemical picture of the patient. The program also suggests a balanced mineral intake so as to ensure that at least 80 kilocalories are administered intravenously, with a ratio of grams of protein on non-protein calories that is around or greater than 20, between 20 and 30. The contributions suggested by the program change depending both on the amount of milk being administered and the type of milk. The algorithm has been inserted to ensure that the patient is administered with adequate caloric and protein and mineral intakes at different stages of parenteral and enteral nutrition. In fact, the program suggests parenteral nutrition intakes in the course of weaning from parenteral nutrition that allows the patient to be always administered at least 120 total calories per kilo per day with an adequate ratio of grams of amino acids and non-protein calories. However, you may not use this algorithm and instead use a mathematical calculation. So, a mathematical subtraction of the desired contributions is made with the contributions of enteral nutrition. Therefore, for example, if we want to administer 12 grams of carbohydrates, the pouch will consist of only 4.96 grams of sugar, resulting from the subtraction of contributions prescribed by enteral. We have seen how to use the ParEnt program for calculating and prescribing parenteral nutrition. With ParEnt, we can optimize and customize neonatal parenteral nutrition. It is also possible with this program to reckon the nutritional contributions administered by enteral and the liquids deriving from other infusional lines, from drugs and blood components. The program also shows the requirements according to the new guideline SDO 2018. It is important, however, to emphasize that the program can never replace the clinician, and therefore the personalized nutritional approach should always be validated by the clinician, and therefore a final check of the prescription is always necessary.